Hello and welcome to part 3 of the Preventative Health Rabbit Awareness Week webinar series. This one's on neutering and sudden death, what happens if things go wrong. So why neuter rabbits? Well, we neuter both males and females, male and female pet rabbits, for a number of reasons. One of the main ones is really population control pertaining to how we keep rabbits. If we were to keep single pet rabbits, one single individual rabbit, then we could argue that population control wasn't necessary and that neutering was unnecessary mutilation, if you like. However, rabbits are extremely social animals, and every time I've seen a single rabbit which is kept by itself, which has apparently been happy, which has then been introduced to other rabbits properly and has bonded to other rabbit or rabbits, their behaviour has, their behavioural expression has increased. They've carried out more species-specific behaviours, and the amount of normal behaviour and positive behaviours has increased and improved. So, I'm pretty convinced that rabbits really should, with very, very few exceptions, be kept in appropriate social groupings, and I think that neutering them to allow that expression of most normal behaviours and to allow them to live in those groups without significant problems justifies neutering of these rabbits. So obviously we could keep them in social groupings where we don't neuter them, and we can expect one of two outcomes. If we have male and female unneutered rabbits together, we can expect breeding, and rabbits are very good at breeding, and they produce lots of baby rabbits very quickly, and that can end up with a massive influx of rabbits in the spring and summer months into rescue rehab places. So inappropriate breeding, unwanted litters, unwanted pregnancies is an important reason for neutering them. We could argue that keeping males and males or females and females together would avoid that problem, but it will lead to fights, it will lead to uncompanionable behaviours. If we keep female rabbits together, whilst they won't tend to cause each other significant physical injury, they very often don't really bond properly. They don't have that companionable companionable behaviour that we would expect as ideal. Ideally, if we see two rabbits in an enclosure together, they should be lying touching, they should be lying side by side, just in contact with one another. It's not uncommon to see female unneutered rabbits who are sat quite some considerable distance away from each other and not paying each other any attention. We could also keep rabbits in mixed sex groups, and we could have them breed. Obviously in the wild, rabbits live in large groups, and they're not neutered, and they behave socially amongst each other. However, during the breeding season, they can be quite aggressive to one another, and they can cause quite serious injuries or even death to the males particularly, and obviously they're breeding in an uncontrolled fashion, which is then necessary because of the high predation risks of rabbits in the wild. They're eaten by almost everything, and they need to increase their population accordingly. They also have enough space to get away from each other, and even in the best of environments, the best of captive environments, it's almost impossible to give rabbits the sort of field-sized spaces they should have, and the complex network of tunnels that allows them to get away from each other when they want to, and so on. So there are lots of behavioural reasons, or one main behavioural reason, so that they can be socially kept together nicely, but there's also physical health problems, and probably the primary one of those is the development of uterine tumours, uterine adenocarcinomas, typically in female rabbits, but there are a few others. So, we're particularly worried about uterine tumours, but we see a whole expression, a whole kind of spectrum, a gradation of lesions to do with the uterus, anywhere from mild enlargement and thickening, endometrial hyperplasia, through to things like mucometra, hydrometra, these really full uterine bodies packed with inappropriate material, exudate, purulent material, etc., and potentially going through that process of abnormality through a kind of cystic endometrial hyperplasia type stage through to uterine tumours, uterine adenocarcinomas typically. We also see mammary tumours in female rabbits, predominantly associated with uterine abnormalities, so there does tend to be a strong link between those two reproductive related problems. So we neuter them, and we ideally want to try and do this sort of somewhere between around sort of 3-4 months or so of age for various reasons. That enables us to neuter them before they potentially fight, and if they hit puberty and they're kept together, two males can kill each other potentially. Now, although that's fairly unusual, they can certainly damage each other quite spectacularly. It's not uncommon for the rabbit who's being attacked to lie on their back and kick out and potentially lacerate with their sharp claws and their strong back legs, to lacerate through the skin and through the abdominal musculature and eviscerate their attacker. More commonly, they tend to kick out against the underside of the rabbit and lacerate through the scrotal skin and cause partial castration and trauma to the testes. That's usually fairly straightforward to fix. We just continue the castration, tidy it up surgically, but obviously if there's deeper damage it becomes much more troublesome, and if any length of time transpires between injury and surgery, then infection is a potential risk. We also have the issue of females attacking males, and sometimes if the male attempts to mate with the female, she'll object to this, turn sideways and bite the ventral underside of the male rabbit, and potentially cause damage not just to the scrotum but potentially to the penis and the urethra, which is a little bit more challenging and can sometimes cause kind of profound urogenital tract trauma and so on. It's important to try and neuter them before mating can take place, because we do have a large number of rabbits presented to rescue organisations per year, and very often those are a brother and sister living together, and they've mated before it's been realised that they were capable of that. It's considerably easier to neuter female rabbits relatively early in life. If we get to them before the 6-month or so stage, we've got a nice minimal amount of fat deposition in this structure in the mesometrium here, this cellophane-like, cling film-like sort of material between the ovary and the oviduct and the uterus, and with the blood supply running through it. If we wait until they're considerably older, a lot of fat gets laid down in here, and that isn't just a tidiness issue. There's a blood vessel here which is fairly minimal, but once we get a lot of fat laid down, that blood vessel starts to thicken and branch and be hidden within the fat layer, so it can be more traumatic to multiply ligate different branches of this vessel, and it's more likely that we'll inadvertently transect one of those blood vessels and cause bleeding, and we have to go through a lot of fat and dissect away a lot of fat, which is potentially traumatic, potentially likely to give rise to adhesions if any of those bits of fat are slightly necrotic or inflamed afterwards, and so on. On the other hand, if we do them too young, we can find that this ovary is quite friable, this uterus is quite friable. It's very easy to exteriorise the uterus and have it just fall apart in your fingers. So very, very gentle tissue handling is vitally important. And it does mean that the general surgery, both at this end to remove the ovary and uterine body and its associated blood supply, and also at the cervical end where things can become quite thickened and quite tricky to ligate. The surgery is generally nicer, I think, for surgeon and rabbit relatively earlier in life. A standard ventral midline incision between the caudal nipples, just up to about 2 or 3 centimetres away from the cranial brim of the pelvis, is the best approach. And then if we do that, we should see the uterus just in front of our incision, with cecum just above, cranial to the uterus. At the other end, at the caudal end, we've got to be careful, we've got to be thoughtful about where to ligate here. This is obviously a diseased, pathologically affected uterus. This has almost certainly got a tumour and some pre-tumorous development, precancerous development on the opposing side. And we can end up with lesions dotted throughout the entire uterus or just on one side or fully throughout both. If we take our approach too close to the vaginal vestibulum, too low down, if you like, we can end up causing interruption of the blood supply to the bladder. So we need to be careful and identify those blood vessels and not transect blood vessels all the way down the vaginal vestibulum. We could potentially go much higher up, but I wouldn't recommend that approach in a rabbit with obvious cancerous changes there. But in a younger rabbit, we could potentially go well above the cervices and not have to worry about going through those, where the tissue is a little bit thicker, more fibrous, and potentially slightly more traumatic for the rabbit. So neutering is really recommended for any rabbit not intended for breeding, which in the domestic rabbit population is really every rabbit, carried out at an appropriate age so that their hormones have settled down by the time they are then introduced to each other to be companionable to one another. It's much easier to bond rabbits if they're not neutered. If they're neutered, it's much easier to litter train them if they're neutered as well. So we can see a range of injuries from the males. This is a lesion which has been stitched up but has clearly gone necrotic. But we see a range of varied and potentially much more serious issues. This is not a traumatic lesion. This isn't an old split in the penis, but we do certainly see conditions where the penis and the urethra have been bitten through and they potentially urinate sideways and all over the place, potentially giving rise to wetness around this area and urine scalding. This is a picture courtesy of S. Elliott where we have a condition called urospadia, where the ventral midline of the penis is not closed in utero, and we end up with this long, almost vulval appearance to the opening here. On the other hand, this is a this is a genetically disseminated characteristic. This is of genetic origin, and so we would consider castrating or neutering any rabbit with this condition, or giving rise to animals with this male rabbits with this condition, in order to avoid spreading it, as we will with any sort of unwanted genetic characteristic. So health issues in male rabbits are relatively much less severe and potentially, well, generally much less common than in female rabbits. Testicular neoplasia can occur. We have testicular enlargement, usually unilateral, often with decrease in size of the contralateral testicle if we've got active hormonally secreting tumours. We have the whole range of tumours. We have the Sertoli cell tumours and the Leydig cell tumours and all the other tumour types that we would expect to find in dogs and cats and so on, even teratomas and such like. Castration is usually curative. These lesions rarely metastasise out of the testicle, not even out of the scrotum. If scrotal skin is involved, then scrotal removal, scrotal ablation can be carried out, but it's rare that they metastasise out of the testicle. So it's in some ways adequate to observe for the development of any problems and then remove them. We're generally castrating rabbits more for behavioural, psychological and social reasons more than physical reasons. On the other hand, prostatic tumours, much rarer, only one reported case that I'm aware of, but potentially much more likely to be fatal. Testicular tumours are easily visible, can be removed relatively easily. Prostatic tumours, not so easily seen, may only be found after extensive workups and may well have metastasised to other parts of the body at that point and require more invasive surgery to remove, which in the case of adhesion or involvement of bladder wall can be a much more complicated procedure. Just a slight change of topic, just to finish on, just talking about sudden death, other than perhaps as a a differential diagnosis for viral hemorrhagic disease, which can cause dramatic, sudden, acute mortalities, often with blood coming from the nose or mouth, blood within the abdominal cavity. I've just put in a couple of lesions which can look potentially similar. This is liver lobe torsion, which can also look a little bit like a foreign body obstruction of the small intestine. Both small intestinal blockages and liver lobe torsions appear in rabbits of any age, any breed, any size, either sex, etc. They're very sudden onset. We can end up with a rabbit which is found dead first thing in the morning perhaps, possibly with blood coming out of its nose. When you open up the abdomen, you might find blood free in the abdomen in liver lobe torsion cases and in viral hemorrhagic disease cases. These are surgical emergencies. They can be anything from acutely anemic, almost about to die rabbits, or they can, in some cases, where this lesion is fairly small in focus, and if it's come on a little bit more gradually and hasn't ruptured, we can find that they just have grumbling, intermittent, severe cranial abdominal pain. We can also see that pattern in small intestinal blockages, where the blockage kind of moves through in little fits and starts because it just about squeezes through the gut and then stops a little bit further on and carries on like that. So both of those conditions can look the same. An acute onset, painful anterior abdomen, the rabbit might be tooth grinding, might be hunched, is almost certainly not eating. The difference is that these tend to resolve surgically and go back to eating quite well, whereas the blockages have a primary GI obstruction, which can be a little bit more challenging sometimes to deal with. We don't know why liver lobe torsion occurs. It can sometimes be the little accessory liver lobe, but it can also be, it can affect any liver lobe, and some of those liver lobes can be quite significant in size. Resection of the affected lobe can be straightforward, but this can also almost be removed with a pair of artery forceps and a simple encircling ligature, up to the use of stapling devices and so on to remove some of the larger lobes. Supportive care, good analgesia, and surgical removal are generally curative in these cases. With foreign bodies, at surgery, you can usually find a foreign body obstruction fairly readily from the outside of the animal, and you can certainly feel it as you run your finger through down the gut. And we can either remove the mass from the gut, or push it back up into the stomach and remove it through a gastrotomy incision, which is easier and less traumatic and less prone to complications than an intestinal resection or intestinal approach. Or we can push it all the way through the small intestine, through the ileocecal junction into the cecum, at which point the diameter of the gut appreciably widens and it can make its own way up from there. That's potentially more traumatic to gut, because you're squeezing the whole gut between your fingers, but is less traumatic on the whole because you're not incising into, you're not cutting gut, and you're not anastomosing gut or trying to close it back up without the risk of formation of strictures or potential leaking. And leaking of gut content into a rabbit's abdomen is almost certainly going to give you a septic or a chemical peritonitis. There's no omentum to wrap around things, and then they're much more prone to intestinal adhesions or adhesions involving the intestine than dogs and cats. We do get some abdominal masses emerging from gut which have encapsulated themselves. I know I said that anything exiting the GI tract freely into the abdomen could cause profound reactions. Well, this has, but it's been very, very localised because of rabbits' ability and tendency to form encapsulated abscesses. So what's happened here, I've seen a few of these cases, perhaps a thick bit of sort of woody grass or hay or straw has worked its way through the wall of the intestine. A sliver of wood, a splinter, has worked its way through the wall of the intestine, and has kind of been walled off as it's emerged, as it's pushed through, as material has moved after it or ahead of it. So it's a wire, if you like. It's the same sort of condition that would give you a wire in a cow has in this case given us a walled off abscess, which can often be resected completely and hasn't adhered to surrounding tissue. So this carries a quite good prognosis if it's that well encapsulated, if it's that discreet, and often these can just be blunt dissected away, and the original hole they've made is sealed up behind them, and they can have a really good prognosis, but intestinal tidying up surgery may be necessary. If this ruptures, this would be expected to give us a really acute onset, dramatic peritonitis and septicemia and death. And in a totally unrelated potential cause of sudden death in rabbits, so rabbits being found dead, often with no premonitory signs, no sort of clues as to this about to happen. Rabbits don't tend to get poisoned that often. They don't tend to go rootling through people's medicine cabinets like dogs do. They don't tend to lick up antifreeze and things. They don't tend to sort of have exposure to those sorts of things. But one serious, life-threatening, potentially sudden death cause that we see is electrocution in rabbits. Rabbits do like to chew through cables, anything that looks a little bit sort of like a sapling or a sort of growing plant. They'll chew through, whether that be fairly low voltage mobile phone chargers and so on, or whether that's heavy-duty electrical items. And the result can be varied. We can see electrocution which causes cardiac arrest. The rabbit literally just drops dead at the site, and it's obviously fairly sort of obvious what's happened there. We can see survivors of electrocution having frazzled whiskers, as in this case. We've got these whiskers that look as if somebody has held a lighter underneath them and they've melted and shriveled up. We may see rabbits that die, that appear absolutely fine at the time but die 24 to 48 hours later, and that's because of the damage that the electrical current has done as it passes through the chest. This is a recognised problem in children and toddlers who stick their fingers in electrical sockets. There's been quite a lot of studies done into this phenomenon where they get pulmonary edema a couple of days later. And the other thing that I've seen is rabbits that have chewed and they've ended up charred around the site, so the whiskers have been okay, but there's been blackening and burning of the teeth and the gums, and those rabbits present with typically anorexia, pain around the mouth, and it's usually fairly obvious. There's almost a smell of burnt rabbit when you open the mouth or when you look around the nose and the mouth end. So that can be another, although it doesn't tend to cause bleeding and doesn't tend to get confused with the other causes, could be seen as a differential. And on that note, I will stop this talk, and I hope you've enjoyed this series of webinars on Rabbit Awareness Week issues.